In this lesson, we will discuss the etiology and characteristics of children with intellectual disabilities. As with many other disabilities, the etiology of ID can be related to a number of factors. The book points out that the cause is often unknown, but we know that ID can be caused by prenatal, or before birth, perinatal, at the time of birth, and postnatal, after birth. Causes can also be identified by type. Causes of ID, when characterized by type, include biomedical, social, behavioral, and educational factors. Biomedical factors include disorders that develop within the individual. An example of biomedical factor is a chromosomal disorder such as Fragile X and Down syndrome. Social factors include issues related to social and family interactions such as poverty. Behavioral factors include causal behaviors such as substance abuse and dangerous activities. A good example of a cause based on behavioral factors includes fetal alcohol syndrome. Lastly, educational factors include access to supports that promote mental development and adaptive skills. The causes by type that will probably be the most prevalent include biomedical factors and behavioral factors. The first biomedical factor we will discuss is Fragile X syndrome, which is a chromosomal disorder. To review, women have 2 X chromosomes and men have 1 X and 1 Y. A gene was discovered in 1991 that is responsible for a break in the X chromosome, which results in Fragile X syndrome. As you can see by this picture, there is an atypically shaped chromosome that is characteristic in individuals with Fragile X. When an X chromosome is broken, because of the influence on the gene causing that break, a certain protein that regulates the brain is not produced. Boys only have 1 X chromosome, so if they have Fragile X syndrome, they're usually more seriously affected. Girls, on the other hand, have 2 X chromosomes and are usually just mildly affected in terms of their learning. In girls, the second X chromosome can compensate for the break in their other X chromosome. Fragile X syndrome is either transmitted from father to daughter, or mother to daughter, or mother to son, but it is never transmitted from father to son because the father provides the Y chromosome to the son. There are some primary physical features that people associate with Fragile X syndrome. In males, these include long faces and prominent ears. The ears are often wider and longer than usual and may project away from the head. The physical features tend not to be as obvious in females. In terms of academic impact, there is almost always a diagnosis of intellectual disability in males. As for the females, if just one of the X chromosomes is affected, then it usually results in milder learning problems. They do have some of the stereotypic repetitive behaviors that are also characteristic in children with autism. However, compared to children with autism, they are far more social and they don't have the social interaction and attachment problems often associated with individuals with autism. Children with Fragile X are also very loving children and can reciprocally give and take socially from others and form good, strong relationships with others. Down syndrome is another biomedical factor. The chromosomal disorder is characterized by 47 chromosomes instead of 46 chromosomes, and that changes the development of the body and the brain. The most common type of Down syndrome is trisomy 21, where there are 3 chromosomes instead of 2 on the 21st pair. Here you see a picture of a normal karyotype at the top of the page, and at the bottom of the page you see a karyotype of a child with Down syndrome, which includes 3 chromosomes on the 21st pair. In addition to trisomy 21, there are 2 other types of Down syndrome. One is called translocation, which occurs when part of the 17th chromosome breaks off. The other is called mosaicism, where there is a mixture of normal chromosome patterns and Down syndrome chromosomal patterns. Both mosaicism and translocation are much rarer forms of Down syndrome. The one we want you to remember is trisomy 21, which is characterized by a 3rd chromosome on the 21st pair. Down syndrome is characterized by the presence of 47 chromosomes instead of 46, which causes changes in the development of the body and brain. Down syndrome is usually discovered at birth, but it can be detected prenatally through amniocentesis, chronic villus sampling, and the Down syndrome blood test. The Down syndrome blood test is the least invasive, but also the least accurate. Amniocentesis is a procedure in which amniotic fluid is removed from the uterus for testing or treatment. Amniotic fluid is a fluid that surrounds and protects a baby during pregnancy. This fluid contains fetal cells and various chemicals produced by the baby. Amniocentesis can be done for a variety of reasons. A genetic amniocentesis can be done to test for certain conditions such as Down syndrome and spina bifida. A maturity amniocentesis can be done to determine whether the baby's lungs are mature enough for birth. Occasionally, amniocentesis is used to evaluate a baby for infection or other illness. Rarely, an amniocentesis is used to decrease the volume of amniotic fluid. Although amniocentesis can provide valuable information about a baby's health, the decision to pursue invasive diagnostic testing is a serious one. It is important for parents to understand the risk of amniocentesis and be prepared for the test results. Going back to facts about Down syndrome, there are some physical features that are important to know. Physical characteristics of Down syndrome in infancy usually include low muscle tone, flat appearance, especially the bridge of the nose between the eyes, upwardly slanting eye creases, small ears, a single skin crease in the palm, extremely flexible joints, and what appears to be a large tongue. Actually, the mouth often is small and the tongue just appears to be large. These physical characteristics may be very obvious, but they also might be very subtle. So after a child is born and there is suspicion of Down syndrome, they do a blood test to get a karyotype on the child and confirm it. The physical characteristics also become more obvious and more pronounced as children get older. Down syndrome is definitely associated with the age of the mother. You can see on the chart the number of births per 1,000 births where a child is born with Down syndrome. The risk of having a child with Down syndrome goes up once the mother reaches the age of 35. Most children with Down syndrome are born to mothers under the age of 35 because most mothers are in their 20s and young 30s when they have children. So someone can certainly have a child with Down syndrome when they're 24 years old. It's just that the rate per birth is lower among younger women than it is with women who are having children over the age of 35. What we want you to remember is the critical age is 35. This chart clearly shows that the risk starts to go way up once a mother hits age 35. By the time a mother is 50 years old, it's almost 1 in every 14 children. Let's switch gears and talk about fetal alcohol syndrome now. Alcohol is not the only thing pregnant women should avoid ingesting. So what are some substances that pregnant women should try to avoid to reduce the risk of having a child with an intellectual disability or related developmental disability? Take a minute and see if you can come up with a list. What did your list contain? Of course, women should avoid street drugs. They should also avoid marijuana and tobacco. Women who smoke during pregnancy are more likely to have babies who are born early or who are too small. Smoking also increases the risk of miscarriage and preterm labor. There is also some controversy about caffeine. Prescription drugs can be harmful, and if you're taking any prescription drugs, you should definitely consult with your doctor as soon as possible. Over-the-counter medicine should also be used very cautiously. Antacids, laxatives, sleeping pills, cold medications, and pain relievers are all either banned or to be taken in very small doses. Kitty litter is also a substance that should be avoided. There is a virus in cat feces that can cause serious damage. For the most part, doctors are very cautious about taking anything other than what would be in a well-balanced, healthy diet. The placenta doesn't serve as a very good shield for the developing child, and anything that the mother takes in goes right through the placenta. The real culprit is alcohol. It is the most dangerous drug to take while pregnant. Fetal alcohol syndrome, or FAS, is the leading preventable cause of intellectual disability. It can obviously be completely prevented if pregnant women do not drink alcohol. It is not limited to chronic alcoholics, though. There are mothers who have indicated that they didn't know they were pregnant and only drank moderately, yet their child was born with fetal alcohol syndrome. People believe now that there might be critical stages of development in utero where a child is particularly susceptible to the effects of alcohol. No amount of alcohol is a safe amount. Fetal alcohol syndrome is very difficult to diagnose at birth because there are only very subtle physical features, and you have to get a mother that admits to using alcohol during pregnancy. Many mothers would not want to admit this because they would fear that somebody might take their baby away from them. We are really not sure how many cases of intellectual disability are due to alcohol use, but experts do indicate that they believe it is the leading cause of intellectual disability. So this is a very serious problem. Some estimates are as high as 30% of intellectual disability is caused by fetal alcohol syndrome. There are some soft physical signs that one sees with children with fetal alcohol syndrome, and these include low birth weight, a small head circumference, failure to thrive on the part of the child, organ malfunction, smaller eye openings, small cheekbones, and a smooth philtrum, which is a little ridge underneath your nose and between your nose and upper lip. As children with fetal alcohol syndrome continue to grow, they tend to have poor coordination and poor socialization skills, especially in building and maintaining friendships and relating to groups of people. Oftentimes, they have an underdeveloped conscience. It is very hard for them to develop a sense of what is right and what is wrong. It can be very heartbreaking because a child really doesn't seem to know right from wrong and is unable to make good decisions and develop empathy for what their actions are causing. So fetal alcohol syndrome creates a variety of learning problems and great challenges. Longitudinal follow-up studies with children with fetal alcohol syndrome show that they often have trouble with the law and they're susceptible to being exploited and manipulated. At the bottom of your screen, you also see I mention FAE. That stands for fetal alcohol effect. There is some controversy about the diagnosis of fetal alcohol effect, but what I want you to know about is that it is a milder form of fetal alcohol syndrome, often resulting in milder learning problems, so you may come across the term in your future studies. Now we are going to move on to postnatal causes of intellectual disability. These are causes that happen after birth but before the age of 18. Usually when they talk about postnatal causes, we are referring to young children or an elementary age child. Postnatal causes of ID include central nervous system infection, accidents or abuse, and lead toxicity. Infections in the central nervous system, such as meningitis, can result in intellectual disability. Babies can be born healthy and then contract a central nervous system infection that causes brain damage. A second cause is an accident or abuse. For instance, if the child falls, or if there is a situation where a baby gets shaken that could result in head trauma. All of these affect mental development and therefore can cause intellectual disability. Lead poisoning is still a somewhat prevalent cause even in this day and age. Lead is in all of our bodies, but if it reaches a certain level, it causes irreparable brain damage. Lead toxicity is especially prevalent in poor areas and highly polluted areas. If children have high levels of lead content, they will need to go through chelating therapy, which removes the lead from the body. While chelating therapy will make the child very sick, it is well worth it in order to get the lead out of the body before it damages the brain. There are a number of learning issues that children with intellectual disability experience. Individuals with ID don't know what to attend to, and teaching strategies that help identify the most important information to attend to are very useful to their learning. Memory is another characteristic. Memory is very important, however, students with intellectual disability experience short-term memory problems. They don't store much information in their working memory, but the good news is long-term memory tends not to be an issue. Children with intellectual disability have very good long-term memories, much like those of typically developing children. Once they learn a concept, their long-term memory stores it well, and they don't have problem with long-term retrieval of information. Children with intellectual disability are also behind academically, but they can learn academic skills. It is just that the acquisition of these skills is much slower. Teachers shouldn't give up on developing academic skills. Most children with intellectual disability can at least learn functional reading, writing, and math skills. Motivational issues are important. Many of these students have an external locus of control, which means that they believe outside influences, rather than their own efforts and initiation, are the key factors that influence their success in life. Having an overly strong external locus of control is associated with a self-fulfilling prophecy and the concept of learned helplessness. We need to teach students with intellectual disability self-determination skills that allow them to set goals, make choices, and see the relationship between their actions and achievement. The next issue is generalization, and it refers to applying a skill across settings and across time. What we see with children with intellectual disability is they don't generalize information very well. You can teach them something in the classroom, but then when you go ask them to apply it in another setting, they have difficulty doing that. Generalization needs to be taught explicitly to students with intellectual disability. The last characteristic involves language development, including vocabulary deficits and delayed acquisition of language. Often, speech and language therapies are needed. Language is associated with thought, so if one has language deficits, academic delays will be inevitable. In terms of the social and behavioral characteristics, these children are at risk of being bullied and victimized. They can be very sweet kids but very immature and can have difficulty establishing friendships. These children need teachers who will watch out for them but not baby them. Finding non-competitive social activities where people are accepting of one another, such as scouting or church activities, are good options. Encourage the children, especially as they grow and develop, to take pride in their appearance.